Good morning, good afternoon, and good evening to everybody. Welcome to the ninth session of the Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas. Today's session is going to be on listening and learning, applications and gaps in current tools and guidance for building climate resilient health systems. My name is Peter Barry. I'm from the Climate Change and Health Office at Health Canada, and I'm going to be your moderator today, and I'm really excited about this session. So just a reminder that interpretation is available, simultaneous translation in English, French, and Portuguese. Just use the button at the globe icon at the bottom of your screen. And so today we're going to build on some of the discussion in the previous session this week on scaling up health adaptation, leaving no one behind, by again really looking at some of the tools and guidance that's available that people are using to build climate resilience in terms of health systems, but also really focus on some of the applications and gaps in those tools, some of the challenges that people might be facing. We're really fortunate to have a great panel of experts to learn from today through their knowledge and their experiences. So we're going to have presentations by those experts. And after that, I'm going to do a brief overview of some of the results from the participants, in terms of the surveys that you've helped to complete, that have been compiled by our colleagues at the Global Consortium on Climate and Health Education. And so this is going to be great. We're all going to learn together in terms of some of the challenges that we're all facing. And then it's going to be really exciting because we'll have a participant of the course who's kindly agreed to present on some of her work, some of her knowledge in terms of the applications of tools and guidance. So again, I think this is going to be a really great session. So just a reminder, in terms of some of the course objectives, we're really to understand the importance of rapidly scaling up climate change and health adaptation actions to prepare individuals, communities, and health systems, describe the key actions for scaling up health adaptation, also to identify opportunities for increasing health adaptation efforts that support the health and health equity, and be prepared to work with a broader range of partners to address current barriers to health adaptation. And to that end, the learning objectives for this particular session are to navigate and select appropriate existing tools and frameworks for specific scaling up contexts and needs, really look at the sequence of the application of different guidance documents and tools for maximum effectiveness, identify frameworks that can be adapted to specific jurisdictional, cultural, and health system contexts, and access and utilize international support mechanisms and networks for health adaptation efforts. And we've already got a really great start from some of the survey results, again, that people have provided that are participating in the course. And just in terms of some of the logistics, it's 90-minute sessions. The sessions will end with a question and answer section. So please start putting your questions into the Q&A box when you have them. The sessions are recorded, the videos are recorded, the slide decks and the resources are made available on the course website, so you can go to them afterwards. In terms of attendance, attendance is automatically recorded during the live Zoom sessions. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join with a colleague's link, and YouTube views will not count towards attendance. So just making note of that. And in terms of the certificate of participation, participants who attend 8 or more of the live Zoom sessions and pass the final exam with a score of over 70% at the end of the course will be awarded a certificate of participation in the climate and health from the GCCHE. And note that the certificate of participation is only available to people who use the same email for registration, all Zoom sessions, and the exam. And this is great. We've been asking people to submit case study examples and to undertake the survey. And now we're going to learn from all this input in this session today. And if you haven't already done so, there's a WhatsApp group that people can join to stay connected in terms of the course. So now it's a real pleasure to introduce our expert panelists, and then we'll get right into some of the presentations. So Professor Rachel Lowe is an ICREA research professor and Global Health Resilience Group leader at the Barcelona Supercomputing Center. The Global Health Resilience Group co-develops policy-relevant methodological solutions to enhance surveillance, preparedness, and response to global health challenges with a focus on climate-sensitive infectious diseases. Rachel's a member of the World Meteorological Organization World Weather Research Program and the Lancet Commission for strengthening the use of epidemiological modeling of emerging and pandemic infectious diseases. We're also going to hear from Avril Diaz, who's a planetary health scientist and the executive director at the Global Council for Science and the Environment, an organization whose mission is to support the use of evidence-based science in public and private decision-making. Before joining GCSE, she co-founded and served as executive director of Walking Palms Global Health, an organization focused on building community resilience amidst climate and environmental disasters. We'll also hear from Dr. Anna Terlashi. Anna is a medical specialist in environmental health, infectology, and internal medicine. She's currently a member of the environmental health team of the Ministry of Health of the city of Buenos Aires, Argentina. Anna is also coordinator and postgraduate professor at the University Institute of the Italian Hospital of Buenos Aires and the teaching and research director of the Ministry of Health of the city of Buenos Aires. And we'll hear from Dr. Johanna Sanchez. Johanna is a global climate and health lead at Grand Challenges Canada, where she's leading the development of a new climate and health program, an environmental epidemiologist and global health scientist with over 15 years of experience. Her work explores environmental predictors of child malnutrition and infection in highly populated regions and includes AI modeling of water quality, and climate data. So I'm really excited to hear from our experts. I understand that Avril will ask you to hear from your presentation first. Avril?
Thanks so much. Okay, welcome everyone. I'm really looking forward to getting to share with you today and then hear from the other presenters. I'm going to share my screen now. Second. Okay. Sorry about that. You'd think that after 5 years of many Zoom presentations, we'd have this all figured out, but here we are. Okay. So again, thank you everyone. I'm going to be talking about one of the approaches I think we can be using to scale up lots of different climate adaptation measures. I'll be focusing on work looking at early warning system co-development to co-delivery processes, specifically in the Caribbean region. And this is really important because I think we have a really great opportunity to be moving from tools to packaged services, and again, always leading through co-production. So, a little background. I'm sure that many of us on the call know one of the most dangerous animals on the planet, Aedes aegypti. It's a vector that transmits dengue, Zika, chikungunya, and yellow fever. It lays its eggs in clean, stagnant water. Breeding sites includes water containers and flower pots, and it's a daytime biter. And this, little creature is responsible for so much devastation around the world, and it's only getting worse as time goes on. So, climate, both natural variability and climate change, are impacting the ways that disease risk is being experienced around the world. And particularly in Latin America and the Caribbean, we're seeing increased vector abundance, we're seeing expanded geographic range, increased habitat distribution, increased virality, and behavioral changes. And as we start to see more and more climate-related disasters and natural disasters in general, this really impacts the risk of people being exposed to these types of mosquitoes. For example, when you have a flooding event and maybe houses are really impacted or destroyed, and now people have to crowd into a house with family members or friends. Now you have more people in the household, perhaps lack of access to piped water because of disturbances. And now you have a mosquito that might be more viral and can be biting more because it's hotter outside. So these are things that we need to consider when we're thinking about planning public health interventions around reducing the risk of mosquito-borne diseases. So what can we do? Well, one of the key adaptation strategies that our team is working on and is gaining a lot of global investment over the last several years is the creation of early warning systems for climate-sensitive diseases. And these are systems that combine climate, environment, and health data. And what it does, it is helps to predict outbreaks before they occur. And that really helps us to enable this early, more targeted action. It helps us to go from response to prevention, right? And the real thing that we can do here is think about how we can use those advanced lead times to optimize resources and prioritize different interventions in different regions that may be experiencing higher burden of disease. So the question here for this session is really how can we make an early warning system that's scientifically sound, locally relevant, and also scalable? So our team did a landscaping study funded by the Wellcome Trust with participants from on the team from University of Florida, Barcelona Supercomputing Center, the IAI, Columbia,
Or
and this was a really important study. What we did was we mapped out and we found over 9,500 papers that were identified in the literature of talking about a type of tool that they were using for climate-sensitive infectious disease modeling. And many of those talked about how it was applicable. But of those 9,500 papers, only 37 tools were actually available to decision makers. So what are we seeing here, right? Why do we have so many people publishing? And there's a lot of excellent tools out there, excellent models out there, but many are not being considered useful to decision makers. It's also important to note that of those 37 tools, I believe it was less than 20 that are actually being used. One of the things that we found is that there's a real true lack of co-production methodology. One of the reasons is that there's a lack of demand identified by decision makers and bringing in decision makers from the beginning of these types of research initiatives. So some of the barriers that we've identified with partners, both in the Caribbean, like the Caribbean Public Health Agency, the Caribbean Institute for Meteorology and Hydrology, and many others, were lack of financial resources, lack of technical expertise, lack of personnel dedicated to climate and health data, lack of mandates to address climate and health work, and lack of formalized partnerships, like MOUs, and challenges in translating forecasts or models into alerts that were really usable and tangible for everyday public health decision makers. So, how do we develop a scalable and impactful climate service that can really help decision makers have more equitable and resilient health systems? Well, we are thinking about three things here. They have to be demand driven. So, what that means is that it has to have come from the country or the local government in saying this is a priority that we really want to work on and invest in. And here's the demand. It has to be co-produced and co-delivered. And this is a really important part because a lot of times projects have a really great get-go, but there's a lack of the actual implementation and follow-up with M&E. And then it has to have a transdisciplinary approach. So what is a transdisciplinary approach? Well, this is what it looks like. It can be messy, right? You have a lot of different actors. So when we're thinking about building early warning systems and the research that goes behind it, all the way to making it operational, we have to think about who should be at the table from the beginning. And those people include health sector people. And you can see within the health sector, there's many different types of people showing up. Climate and meteorological organizations, the research institutes, different NGOs, IGOs, the funders, local communities, media, and private sector. Now, transdisciplinary science is really important and can take some time to get used to and understand that there are language barriers, and not the language barriers that maybe we're more traditionally used to, but transdisciplinary science is really thinking about how can we translate the language of research institution for health professionals or for climate professionals or NGOs? And how can we really be strengthening all of the different actors to come together and provide perspectives that are going to lead to a more useful system? So here are some of the countries that we've been working on for early warning system co-development. And uh, I'm going to just touch on these five right now. These three, Barbados, St. Lucia, and Grenada, are where we are piloting the implementation and operationalization of the early warning systems that we've been working on. And now we're going to start some new work in Trinidad and Bahamas, expanding those systems. So really touching on that scalability. This process really involves co-learning at every step of the way. And we published a paper that goes through this process. So if you're interested, you can take a look at that. And these are some pictures of us visiting the Caribbean Public Health Agency and with our partners with the Grenada Met Services, and then our partners from the Caribbean Institute of Meteorology and Hydrology. We have the Barcelona Supercomputing Center, GCSE, University of Florida, CARFA, II. So you can see there's a lot of different actors here. So one of the things that we've been doing in terms of being able to make a more scalable approach to early warning system development in the region, we began before I got involved in the project. So the work started in Dominica in 2017, and I joined the project in 2019. And from then, we've really been thinking about how we can start to package a lot of the different parts of the project that have led to this being able to pilot where we are at today. It's continuous co-learning. We start with the country permissions. We then go into initial partner meetings. All of those partners are brought to the table to really discuss what are the priorities for each of the countries? How can we really integrate community perspectives? Then we go through stakeholder mapping. We then conduct a feasibility assessment and socialization of the project with lots of the different stakeholders in the different countries that we're working with. And then we build the conceptual model. It really helps us to understand what are the things that we're going to need to put into the model that we're developing and really understand the cultural context and significance of what types of public health interventions are being used at these different areas. We do a lot of stakeholder capacity building in thinking about intros to technical components, and then we go through the data gathering phase. The technical leads have then put together the data harmonization, running and building the disease risk models, calibrating the forecasts, again with partners, getting to disease prediction, and then again training. Training is happening at every steps of the way, so that way we're really building up that regional capacity so that these systems become more sustainable. We then talk about the different graphical outputs, the alerts, interventions, community educations, and then do another training. And then we go through the testing, piloting, implementing, operationalization, monitoring and evaluation, and then reporting. And we have been, working in these three areas. And right now, we're really focused on the implementation and operationalization of these systems, as well as M&E in the three countries, Barbados, St. Lucia, and Grenada. And now those early warning systems have been really important and really focused on dengue and vector-borne diseases. I just wanted to give a quick example of what those stakeholder meetings and partner meetings look like when you take the conceptual model and really build it out. And you can see it's very complex, and it's really important to get all of the different perspectives. This is what the early warning system platform looks like, and Dr. Rachel Lowe will go into it a little bit more in her presentation next, more of the technical side of things. But I just wanted to show you that this system is really meant to be able to bring in countries that want to participate and receive this type of technology. It's an effort led by the Caribbean Public Health Agency. The first set of funding came from the European Union, and the second set of funding now has come from IDB. And you can see here that it's very visual. There was a lot of iterations of this particular. This is just one screenshot. I'm not going to go through the whole platform, but you can see that it's very meant to be for decision making. You can see it looks very different than a traditional model output for EPI, right? It's there to really inform, and different countries have different ways that they want to view the outputs in terms of a PDF output or just right through the platform. And you can see that the traffic light covers really goes over what is your risk and what is the probability of that outbreak occurring 3 months from now. We've also developed some frameworks to go over how we're taking the tool side of things and really turning it into a service. So going through questions like what are the meteorological variables that are important for explaining dengue risk, and what is the probability of exceeding a threshold, to taking it to a service in terms of how will stakeholders maintain involvement, who's going to do the M&E, and what is the return on investment. You can check out this publication, and we can send it after so that way you have access to it. But this is the framework that we built to really help other teams to think about how they can begin to implement different climate tools. And it doesn't necessarily have to be so specific to dengue and other vector-borne diseases. It's designed to be more broad, to really think about how we can really take tools to services and get them implemented in different areas. So what do we need to do for scaling up in regional integration? Well, one of the big things is that we have to build trust and national ownership through country-driven model design and demand-based implementation. The models are designed with the context of each of the countries involved, and we really focus heavily on those initial meetings and constant feedback from our partners and stakeholders throughout the way to make sure that it's not just a cookie cutter scale up design, that it is still thinking about what are the needs and the priorities of the countries that are going to use it. But at the same time, the platform was designed so that it can integrate new countries and additional climate sensitive diseases. And then the regional sustainability plan, thinking about this, we are very fortunate that our partners at the Caribbean Public Health Agency are really paving the way and really focused on climate and health adaptation. So the regional bodies will be in charge of maintaining the system, providing IT services and data protection. And then our partners at the Caribbean Institute for Meteorology and Hydrology are helping with the climate forecasts, which really helps to make this a lot more easier for countries to not have to spend more time and resources on trying to develop that themselves and integrate it into the models. And then continuous capacity building. So we really want something that's scalable, sustainable, and regionally owned. And then this is my last slide. You can see that there's a lot of people involved in this work. And the partners have really made such an effort, and it's been something that we think is really building climate resilient health systems. So thank you very much.
Wonderful. Thank you so much, Avril. It's really a great emphasis on moving from tools to actually services and how important that is for actually scaling up. And maybe we'll hear about some of the challenges in terms of using tools in that regard. But now I'll turn it to Rachel. Rachel, we've already done introductions, so I'll ask you now for your presentation. Over to you, Rachel.
Thank you so much. Give me a moment to share my screen. Can you see the slides?
We can.
Okay. So I'm delighted to follow after Avriel Diaz. We've been working together for several years now on our co-creation work in the Caribbean. I'm going to share some of the details behind the modeling tools that we develop as part of this co-creation process and some of the challenges around implementing them locally. So just to kick off, a little bit about how we can think about and frame the climate sensitivity of infectious diseases. So we know that the climate can shape the geographical distribution of certain diseases in terms of its global distribution, its seasonality, intraannual variation. But with anthropogenic climate change, we're starting to see a shift in the seasonality or a lengthening of the transmission season. We're seeing shifts in the distribution to higher altitudes or latitudes. And we're also seeing a change in the timing and intensity and duration of outbreaks due to warming temperatures, more unpredictable weather patterns, and changing precipitation distributions. So we've been looking at ways that we can incorporate different kinds of climate information into decision support systems to help public health authorities be able to use this information to be better prepared. And this information can range from observations sourced from weather stations or satellites or reanalyses, or they could be products which include weather forecasts or climate predictions from subseasonal to seasonal to decadal timescales, or climate change projections, so we can understand how the climate may evolve going into the future, given different scenarios and decisions taken by governments. So at the Global Health Resilience Group that I lead at the Barcelona Supercomputing Center, we're working on many international projects funded by the Wellcome Trust, by Horizon Europe, and several different agencies together with academics and international research centers, humanitarian centers, environmental agencies, and ministries of health to work on integrating climatic and environmental information into decision support systems to build resilience to emerging disease threats. We have very strong partnerships in Latin America and the Caribbean region, also in Europe, in Africa, and parts of Asia. And these tools are designed to improve preparedness and response, for example, to mosquito-borne diseases, to help guide interventions to the areas most at risk, to guide adaptation measures, to evaluate interventions, which may be vaccinations or Wolbachia to try and prevent dengue, and also to try and guide the distribution of loss and damage funding towards those areas that have suffered the worst consequences of climate change. And at the Global Health Resilience Group, we're developing a suite of digital public goods, some of which have been recently included within the Global Goods Guidebook, which was published recently by the PATH Initiative, which includes our GHR suite of tools, which allow users to harmonize and model multi-source data sets to be able to build these kind of early warning systems, which I'll go into detail in a moment. A few years ago, members of our group, both at the London School of Hygiene and Tropical Medicine and the Barcelona Supercomputing Center, published a book chapter where we detail a framework and the different components involved in developing an early warning system for vector-borne diseases, including issues around engagement, such as building partnerships, conducting feasibility studies to understand the evidence around the problem, the data availability and the resources available, the tool development phase, for which we're now developing different kinds of reproducible tools, and also the challenges around implementation. And all this work really depends on strong partnerships, as Avriel detailed in her presentation. These are some images from different field trips that we've conducted with partners in Barbados, together with regional and national level stakeholders. And all of this depends on the partnerships and the buy-in from regional and national agencies, together with different funding bodies and our interdisciplinary team of researchers to be able to build these kind of solutions. And over the years, we've been looking at different methodological innovations to try and capture the delayed and nonlinear impacts of different kinds of climate extremes and how they interact with each other to try and build a simple yet effective early warning system that can be implemented in an operational framework. So we've developed an approach where 3 months ahead of a target month, we can analyze the conditions in the previous months and the current month and combine this with the forecast for the upcoming month to make some kind of risk estimate that is shared with the public health agencies. So, for example, if we're if we want to issue a forecast for the month of June, then 3 months in advance, if we have been experiencing very dry conditions and it's currently hot, and then we have a seasonal forecast saying that the conditions are expected to be wet, this combination of hydrometeorological indicators will give a high-risk dengue outbreak alert. Whereas if the conditions have been dry and it's currently cool, and the forecast for conditions to continue to be dry, then the modelling framework would issue a low risk of dengue. And this information can be combined with other sources of epidemiological intelligence to calibrate and make sure it's utility for the current situation. And alongside the modelling work, we've been working on documenting our co-learning experience. And as Avriel mentioned, putting together an implementation framework for climate services for health. And this co-creation process has also been included in the World Meteorological Organization State of Climate Services for Health report. So alongside our engagement and our modelling work, we've also been developing capacity strengthening and knowledge exchange activities. We've delivered training materials around using R and working with data and translating this data into decisions in the Caribbean, also in Sri Lanka. We have an example here. And these kind of activities bring together different actors, including academics, epidemiologists, national control, dengue control programs, and different players that need to be around the table and working together with these data sets. And of course, to be able to build these data-driven early warning system models, we first need to have robust data sets to inform them. And often the kind of information you need to build a climate-informed decision-based modeling approach are multi-source and have different formats. So we may have to work with data from weather stations or from clinics or from gridded climate products or travel data. And so all of this requires a data harmonization approach, which involves defining exactly the question you want to address with this data, conducting data audits, organizing data sharing agreements, which can take months, but are very important to ensure data ownership and data justice. We need to quality assure the data, to post-process it, to make sure everything is well documented, tested, disseminated, and updated on a routine basis. So as part of the Harmonise project, which is funded by the Wellcome Trust, we've been working on strategically collecting new sources of data using drones and weather sensors in areas where we may be lacking data so that we can better understand the local processes related to disease transmission. Here are some images from a field campaign that we conducted in the Colombian Andes, where we're installing weather stations along an altitudinal gradient so we can understand how well the gridded global products, such as ERA5 land, can actually represent the local conditions which are most relevant for disease risk. And we've also been using drones to understand hotspots for disease transmission, for example, where you may find illegal fly tipping or other unintended breeding sites. So here we can see one of our hotspots. This is the state of Tolima. Cajamarca is within this state. And we can see the red symbols are showing the existing weather station network. In orange, we can see our target area where we're installing the 3 weather stations. And the blue grid is showing the spatial resolution of the reanalysis product ERA5 land, which is approximately 9 kilometers squared. And then the seasonal climate forecast that we're interested in using to make disease prediction several months in advance, that's a much coarser resolution of around 100 kilometers squared. So we're developing toolkits to allow users to be able to post-process and downscale these seasonal climate forecasts to a finer scale grid and also to the local weather stations. So as part of the Harmonize toolkit, we have a suite of different tools, these different modules to allow our users to harmonize climate, socioeconomic, health data, land data, and we also have some advanced packages to be able to deal with data cubes and processing drone images. And in a few weeks' time, we'll be conducting our first training course in Brazil with around 25 participants from across the Latin American and Caribbean region to be able to transform the participants' data into an analysis-ready data set so they can use this in their work going forward. So as part of the Harmonize project and also our ID Extremes project, we're building a pipeline, the Global Health Resilience Toolkit, which allows users to harmonize different types of health and climate data and then use our packages to explore the data, to model the data, and to make forward-looking predictions. And this toolkit has been developed in collaboration with different public health institutions, humanitarian organizations, meteorological services, including the InfoDengue team in Brazil, Médecins Sans Frontières, and the meteorological services in Barbados. So here are some examples of how the toolkit is being used in practice. So this is an example of an early warning system that was released to the Barbados Ministry of Health and Wellness several months ahead of the 2024 Cricket World Cup that was held across the Caribbean in June. And so the model framework that we've put together issued a very high risk of dengue outbreak given the combination of climate conditions that have been observed, which issues an alert to take action. And our partners in the Ministry of Health, they have a series of protocols that they initiate when they have these kind of alerts. And given the mass gathering that was happening, there was already a protocol in place to ramp up surveillance. But given this additional piece of information, extra control measures were put into place to be able to prevent an epidemic from evolving. We've also been using the toolkit to take part in the InfoDengue Dengue Forecasting Challenge, which was first initiated last year to predict the evolution of the 2025 dengue season. So last year we took part alongside several different modelling teams to make different kinds of predictions for states across Brazil. Here is an example on the left. We can see in the black dashed curve shows the observed dengue cases for the state of Amazonas in 2024. This was a validation set. And the orange curve shows the prediction from the Global Health Resilience Model, which did a pretty good job. And then in this year's sprint, there was a more formal competition with many more teams, and the models was in the top two ranking of a model accuracy across the states. So this is very reassuring for the potential application of these tools in different operational settings. We've also been using these tools within a framework that we've developed called EndCast, which is a forecasting system for endemic regions. This was initially developed in partnership with many institutions across the Latin American and Caribbean region in response to the 2023 El Nino event, when our partners wanted to know how this El Nino event could potentially impact the outbreaks of dengue and malaria in particular hotspots, particularly in the western coast of South America and in northern Argentina and southern Brazil. So this is a work in process. We've been innovating and developing this tool as we gather new modeling approaches, new data, and new ways to visualize and communicate this information to our stakeholders. So I would like to thank the Global Health Resilience Group and all our collaborators and our funders, and I look forward to the discussion afterwards. Thank you very much.
Wonderful. Thank you so much, Rachel, for that great presentation. I noticed that you recognize the importance of obviously having available data, but also capacity building. And really interestingly, through the survey of participants here, those were identified as possible challenges to using tools and guidance. And so perhaps we'll get into some of that discussion a bit later. But maybe now I'll turn it over to Anna for her presentation. Please, Anna.
Hola a todos. Bueno, muchas gracias por la invitación. Rachel, Gabriel, me quedé anonadada de las cosas que están haciendo. Las felicito. La verdad que son importantísimas
You're doing so many
para
things.
la prevención
Congratulations.
en
You're
toda
so
América
important
bueno, como
for
para
prevention
difundir
in
a través de
America,
los países donde
in the
todavía
whole
no están usando este
continent, and
tipo
also to
de
disseminate
plataformas,
this
este tipo de
information in other
herramientas.
countries where
Voy
they're
a
not
ya compartir
using
mi
these tools
presentación.
yet.
Yo hoy lo que
Well,
les
I'd like to
traigo,
share my
ahí
presentation.
estamos. Ahí estamos. Yo hoy lo que les traigo es un poco cómo nosotros acá en la Ciudad de
Today,
Buenos Aires, yo
I
trabajo en la
would
Ciudad de
like to
Buenos Aires,
tell you that
cómo
I
estamos
work in
llevando
the
y
city
cómo
of
estamos
Buenos Aires, and I
utilizando
would like to tell you
las
how we are
herramientas y cómo las estamos
using
adaptando
our tools and how we are
a nuestras
adapting them
necesidades. Y
to
bueno,
our
también
needs,
las brechas
and
que
also
tenemos
the
para
gaps
hacer la
we
adaptación.
have when it comes to adaptation.
Bien, acá lo que nosotros utilizamos generalmente son los planes
What we
nacionales,
usually use
el plan de
is
alerta
national
temprana
plans. We have the
y
early
algunas guías que hemos
warning
utilizado, algunas
plan,
partes de las
and
guías
we have
de
used
fortalecimiento del sistema de
parts of
salud
the
y evaluación
guides
de
of the
vulnerabilidad y adaptabilidad.
VNA
Nosotros en
assessment
Argentina tenemos
and
el Plan Nacional de Adaptación y Mitigación al Cambio
frameworks
Climático y
to
también tenemos una
strengthen
estrategia
public health
nacional en
plans.
salud.
In
No así,
Argentina, we
no
have a
tenemos una
national
estrategia
health
local, al menos
strategy and
desde Buenos
adaptation
Aires, eso
mitigation
todavía
strategy, but
no se
we do
llegó a
not
ver
have a
más.
local strategy
Por
in
otro lado,
Buenos
también en
Aires.
Argentina tenemos
Also
sistemas de
in
alertas
Argentina, we
tempranas
have early
realizados por
warning
el Servicio
systems
Meteorológico Nacional,
implemented by
donde se
the
prevé que
National
hayan chaparras,
Meteorological
inundaciones,
Service. They work with heat
se
waves,
activan a través de
drought,
la
etc. And
plataforma del Sistema
these
Meteorológico
warnings are
Nacional.
activated through the National Meteorological
Nosotros hemos
System.
utilizado el marco
We
operacional
have
de
used
construcción de
the
sistemas de salud
operational
resilientes al
framework for
clima.
building climate
Nos
resilient health
proporcionó estructuras
systems.
como para empezar a
This has
desarrollar
provided us a
ciertas
framework to develop
experiencias piloto, por ejemplo, de
to
unidades
implement some
sentinelas en
pilot
algunos hospitales
experiences, for instance,
públicos de la Ciudad de
sentinel
Buenos
units
Aires.
in some public
Y
hospitals
la
in
idea
the
de a
city
poco
of
es ir
Buenos
integrando y
Aires.
articulando los 10
We
componentes
want to
de cuál es el plan,
gradually
que todavía
integrate
estamos en
the
desarrollo.
10 key components in this plan,
También
and this is a
utilizamos la
work
guía de
in
vulnerabilidad y
progress. We also
adaptación,
use the climate change
que está ahí a
vulnerability and
disposición
adaptation
también
assessment
para realizar
guide.
un
This
trabajo que
was
hicimos en el año
used to
2023, que ahora
to do
se los voy a
some
presentar
work
muy
conducted
cortitamente,
in 2023. I'll tell you about
donde
this more
nosotros
later
pudimos
on.
analizar
We
la
were able
exposición
to
de personas mayores
analyze
de la ciudad
the
a las olas de calor. Hicimos un
exposure
análisis
of elderly
de
people to heat
sensibilidad y
waves in
después
Buenos Aires.
vimos qué
We
capacidades tenían las personas
analyzed
mayores
sensitivity and
para ser más
also these
resilientes
people's
a
capacity
los efectos
for
de las olas de calor en la ciudad.
resilience to heat wave
Bueno, y
effects
después
in the
tenemos otras
city.
herramientas que
And
hemos
we have other
utilizado,
tools
como
that we
los
have
planes
used,
de
such
acción
as
en salud y
the
calor. Acá yo
heat
traje el
health
plan
action plans. This is
que
the
está
plan
presentado para todas las
presented
Américas y traje,
for
nosotros
the
hemos usado,
American
nosotros dentro de la ciudad
content.
no tenemos un
In
protocolo
Buenos Aires,
todavía
we do not
para clima
have a
extremo,
protocol
no
yet
está
for extreme
desarrollado.
heat. It
Hemos,
hasn't been
nos hemos
developed yet.
guiado, si bien,
Therefore,
digamos,
we
las temperaturas son
have,
diferentes acá que en Río de
although
Janeiro,
temperatures
hemos tomado
vary,
muchas partes
are
para
different in
la
Buenos Aires than
creación
in
del
Rio de
protocolo de Río de
Janeiro. We have
Janeiro.
used the
Bueno,
Rio
¿y
de
qué
Janeiro
brechas
protocol for
encontramos
many
cuando
decisions.
nosotros tuvimos que desarrollar nuestro
Tool
trabajo, sobre todo en
gaps.
esta experiencia que
When we
hicimos con
did our
personas
work in
mayores y olas de
particular
calor?
in this project with
Nosotros
heat
encontramos
and elderly
insuficiente, sobre todo,
people,
insuficiente
we
integración
found that there
intersectorial.
was
Desde el Ministerio de
insufficient
Salud tuvimos que
intersectoral
salir a buscar
integration.
a
The
diferentes
Ministry
actores
of
dentro del
Health
gobierno de la
had
ciudad
to
que
find
estuvieran
different
trabajando en
stakeholders
cambio
in the
climático
city's
y que
government
quisieran hacer
that were working
el
on climate
nexo
change
con
and that
salud.
wanted to
Eso
work in the
al principio
nexus
fue
with
bastante
health.
engorroso porque
That was quite
si
difficult at
bien
the
nosotros
beginning
tenemos un plan de acción climática
because
2050
although
para
we
la
have a
ciudad, todavía el sector
2050
salud está muy
climate
afuera de ese plan
and health
y cada vez que nosotros
plan, the health
intentábamos
sector is not
abordar
really included in
cómo
the plan.
los
And every
riesgos
time we try
climáticos
to
iban a
address
afectar
how
a
climate
la
change
salud
would
de la
affect
población y específicamente a la salud de las personas
the
mayores
health,
dentro de la
people's
población de la
health,
ciudad,
in particular older
no
people
estaba
in the
como
city,
priorizado ni para las inversiones ni para los
this was not a
financiamientos.
priority for
Lo otro
investment
que hemos
or
tenido es
funding.
voluntad política inconstante.
Also,
Nosotros
there
identificamos
is
nuestro trabajo en cambio a nivel
a lack
nacional
of
y un cambio a
constant
nivel del
political
gobierno
will.
local de la Ciudad de Buenos
The
Aires, un
local and the
cambio
national administrations have changed since we started working on this, and how the administration sees climate change has changed drastically from one administration to the other, and that has also been a problem. Another obstacle, funding. We are a technical team within the Ministry of Health. We are not a research team. And access to funding, we did our work thanks to the IAI and the seed grant they provided. But regarding funding, we do not have teams ready to request funding. And access to funding is quite difficult, in particular for technical teams, or even when we have talked to local first level stakeholders in first care systems, community health services, public hospitals. There are very few teams that can access large scale funding because of the complexity of accessing these funds. And this is a huge gap. Also, there is incomplete data. We cannot access a lot of data. And what we did was to produce data from scratch. Also, there is a non-integrated surveillance system. We have an early warning meteorological system, but it does not interact with health data. Although we have a heat wave alert early warning system within the National Meteorological Service, there might be some risks for some types of population, but there isn't a connection with preventive actions when the warning is activated. They started doing this after our work, very gradually. Research policy gap, I've said this before, we are not a research center, and many of the studies that have been published, when we try to implement them or elevate them to decision makers, because I'm part of the technical team, but I am not a management or political member. So when we need to talk to decision makers, things get difficult. Also, we have unprepared workforce. In most of the effectors, health professionals are not aware of the problems caused by climate change on the city's people health. And also there is an issue with funding, health infrastructure and climate change. We analyzed all this and we found several challenges that we could address. For instance, personnel training and capacity. You organized a course within the Ministry of Health about climate change and health impact in order to study local effects and also what can be done locally within the city. Another challenge, language. Although most of the health staff and those of us who work in our team speak English, many staff members in hospitals and health centers do not speak English. So this is a barrier and a huge challenge. Finding material in Spanish, at least for us. Maybe this applies to other jurisdictions with other languages. This is a problem because the tools are in English, everything is in English. I'm so grateful for this course and to the Buenos Aires colleagues. It's great that this course is taught in several languages. Regarding funding and challenges, it's important to have access to more funding, because if you lack the training to request funding, you never have access to this type of funding that can actually provide resources to implement the projects mentioned, for instance, by Avril and Rachel. Indicators. Although since 2019, the health system has been included within an IT system, we find it difficult to access some health indicators. What we did was try to find indicators that would be assertive. Maybe not perfect, but at least they exist so that we can follow up on them. And finally, challenge 7, intersectoral collaboration with smaller groups to start addressing these initiatives. This is the work we have done. First of all, we conducted a V&A study with the urban anthropology team of the University of Buenos Aires. We created this map where we where we detected which were the hot spots during a heat wave in the city of Buenos Aires. The south of the city is the most vulnerable area. In pink, you can see the areas in the city where the heat wave reached over 35 centigrade degrees. And we also added the density of older people in black, where we can see the darker spots, where there are more older people. And in the city of Buenos Aires, unfortunately, we usually have electricity surges during the heat waves, and that makes things worse. In blue, on the map, you can see where we usually have these powers cutoffs. And here you can see the hot spots where we had more people, higher temperature, more electricity problems. In Buenos Aires, we have an aging population. Over 25% of the population are over 65 years old. And this means that this is something to consider for us when it comes to preventive public policy making. In this work, we distinguish between vulnerable areas. In red, in the south, we have the vulnerable areas, and the rest of the city, which does not include vulnerable areas. We worked into 4 focal groups. We conducted 634 surveys that were representative of the complexity of older people throughout the city, according to age ranges and areas, north, center, south, and also neighborhoods. We mapped all the strategic stakeholders that might contribute to designing prevention strategies. And we also created an intersectoral group, but it's small, as I was saying before, but it's a small step to keep developing these strategies. With this group and the transnational work done with information from the focal groups and the surveys to administer to older people, we worked with 2 older people and the intersectoral group. We developed these strategies. We created 25 strategies, some specifically for vulnerable areas, others for the formal city, and others for the entire city. This includes managing hydration points in these hotspots that we detected on the map. Also, increasing the frequency of trucks in vulnerable neighborhoods. We were able to work with caretakers of older people to work with climate change impact so that these caretakers would have the necessary tools to have with these people. Also, we started to create a network with the building managers. There are many high-rise buildings in Buenos Aires, and there are building managers. We created a network with them to train them because these buildings include many older people. Also, it is necessary to implement mass television and radio campaigns during extreme heat waves. Also, we need to train family members in preventive measures. Also, we need to empower older adults as environmental promoters to disseminate good practices in their age range in the institutions of older people or retired people. Also promoting the use of green spaces add climate shelters in vulnerable neighborhoods, and strengthen registration via Sentinel units. Buenos Aires doesn't have its own climate change and health guide, but in two provinces of Argentina, they do exist. They were created within the 2021-2022 readiness project, and the city of Buenos Aires now wants to promote these efforts to have its own action protocol to address climate change impacts on health for the city. Thank you so much.
Wonderful. Thank you so much, Anna. It was really helpful to go over some of the guidance that you have used in sort of your efforts to address climate change impacts on health, the various different types of guidance. Thank you so much for that. So now I'll turn it over to Johanna for her presentation. Johanna, please.
Great, thanks so much, Peter. Hi, everyone. Buenos dias. So great to be here today, and such great presentations. It's really exciting for me to see the tools and innovations and how they're also applied in real life in the context of climate and health. So I come here to bring a different angle. I come here to really talk about the financing side, funding innovation at this nexus of climate and health. I think we all know the challenges that exist right now. I sit in an interesting position of both being on the funder side and also being a grantee myself. So I know the challenges around wanting to develop these tools and innovations and how limited we are in this funding, especially in the current landscape. And so I'm happy to share with you an exciting program that we're building at Grand Challenges Canada and we'll be launching very soon. Just very briefly, Grand Challenges Canada, for those of you who aren't familiar with our program, we are one of the world's largest impact first investors. We are an innovation platform that receives support from the Government of Canada. So we deploy government funds to support innovation, whether it's scientific, so technology, business, or social innovations, all around the world to save and improve lives of underserved communities. We work in about 110 countries around the world. We have supported over 1,600 unique innovations. And we're very proud and really supporting locally led, which means that we're supporting organizations that are based in low middle income countries. We fund different stages of innovation from early stage proof of concept ideas to transition to scale. And in our new strategy, launched just a couple months ago, we are really focusing on scaling up all these incredible tools and technologies that are being developed. And we've heard some examples today. Grand Challenges Canada applies a very unique approach. So we define what's called Grand Challenges, where we identify significant barriers that if they are overcome, we believe will lead to transformational impact. And this is an actual mathematical concept, the Grand Challenges concept. And we launch competitions. So the climate and health one will be upcoming in 2026. Where people can apply for funding, and then we support innovators throughout the time that they're funded by us, and hopefully we can fund as they develop their innovations along the different phases. And as I said, we have funded over 1,600, but of those we have about 320 that are now working towards scaling. So really scaling up these ideas, and we've reached over 88 million lives. And we invest in social returns. We invest in lives. That's the returns that we seek. We are not looking to, we are a nonprofit. And so we are really looking to save and reach as many lives as possible. And so Grand Challenges Canada is really rising to the challenge. We really see that the climate crisis is a health crisis. And we really understand that countries that have contributed the least to this crisis are being disproportionately impacted by its effect. We also recognize that strong international efforts are needed more than ever, especially in the current geopolitical context. But we also see an opportunity to use innovation for impact. And so we need to identify the critical barriers to overcome climate and health adaptation so that we can build lasting resilience. And we propose using the Grand Challenges approach to meet this challenge. And so that's why we're launching a new $50 million climate and health innovation program that actually hopes to deploy over $150 million in the next 5 years, but launching with 50 million in 2026, eligible to all low middle income country innovators in low middle income countries. And so the name of the program is NEXA, Climate and Health, led in partnership between Grand Challenges Canada and the Science for Africa Foundation. And the idea is really to support locally led innovations. We'd like to bring that 66% all the way up to 100 if we can, and supporting from early stage to scale innovation. But we really value that regionally guided that we've heard mentioned earlier today, that local guidance. And so just as we believe that locally led solutions are vital to overcoming these health challenges that we're seeing, we really believe that local insights are crucial. So how do we even identify what are the priorities? What should we even fund in the first place? And so we believe that health workers, scientists, innovators, and everyone basically placed in low middle income countries dealing with the health crisis and how that's being impacted by climate change are the people who are best placed to tell us what they're seeing in their communities. And so recognizing that we as an organization are quite removed from the front lines of this challenge. And so in January 2025, we launched the Global Climate and Health Survey, which aimed to identify what some of the most urgent climate health related challenges were in low middle income countries. It was led by Grand Challenges Canada in collaboration with some partners, and we ended up having over 60 dissemination partners around the world, and we thank those who are present on this call. It ended up being the largest climate and health survey ever conducted, with over 6,400 respondents from 107 countries, primarily from people in the health and humanitarian communities. And these results are going to be critical and have been critical, actually, in guiding the direction of the new Climate and Health Program, or NEXA, that we will be launching. I'm going to share with you some very key results that came out of the survey, but I wanted to share that the results have not yet been published. They'll be published likely in the Lancet Planetary Health in the next few months, where all the details of the survey will be made available in an open access publication. So stay tuned for that, because we want as many people to have access to this information to hopefully guide policy, research, funding, whatever it may be. And so this sort of gives a breakdown of responses across the world. Of course, we focus in low middle income countries. Responses were pretty divided between, country level. We really see, high level ministerial versus a district level. So like public health administration, and also community level. So like community health workers, for example. We had several hundred answer the survey as well. The majority, we'd say about 30% were clinical health workers. We also had public health professionals, community health workers, just to give you an example of some of the people who were responding to this. We also had NGOs and ministries of health who were heavily represented as well. And about 44% of respondents operate in rural areas. And over half of the respondents see themselves as very intimately connected to their communities. They see themselves as family to the community. So very important insights from the people at the front lines of the climate and health intersection challenge that we're seeing today. So two key questions of the many questions that we asked in the survey, and as I said, those will be published very soon, is one was really to try to identify what are the greatest climate health threats that people are seeing worldwide. So in the last 2 years, which of these climate changes that you've seen have been the biggest in your community? And those are some of the examples there, that it's unusually hot, that there were more floods than before, more diseases carried by insects, not enough water. And of course, this is worded in a way that we can capture different levels of education. We also asked, how do they see these climate threats impacting health? And so in the last 2 years, which health problems have worsened due to climate change? And there were several questions leading up to this, but we wanted to see how has it worsened health problems that we're already seeing in the community? And so diseases spread by insects, for example, chronic disease, either breathing problems, mental health issues, illness from bad water, heat-related illness, food security, malnutrition are some examples. So some key results from the Americas were that people overwhelmingly expressed that it is unusually hot, that they're experiencing increased number of heat and heat waves, and when we saw the qualitative responses, people are very concerned at the number of hot days that they're all seeing. And this is, again, all of Latin America and the Caribbean. They're also seeing more flooding and diseases carried by insects, so vector-borne infection. And in terms of health threats, the greatest threat was seen to be vector-borne infection. In particular, in the Americas, a lot of concern about dengue fever. Chronic diseases, also a major concern in the Americas, very concerned in terms of how, for example, air pollution and heat are particularly impacting people with pre-existing conditions. And a lot of concerns in particular about breathing problems or allergies. A lot of people are seeing an explosion in allergies as an example. So here's some of what we're seeing again in the Americas. And so really looking at these results and the results of the whole world, because I'm just showing you the regional results of the Americas. And again, also we had several other inputs. We had an expert panel that we also convened from around the world. We conducted an ecosystem analysis to actually look at how other funders are looking at the space to make sure that we are going to add value as well through innovation. And we have decided to fund in these three areas: climate sensitive infectious disease, climate resilient and healthy food systems, and climate responsive chronic disease management. The two, climate sensitive infectious disease and the chronic disease, are very responsive and relevant to Latin America. And so for vector-borne disease, we're really going to focus on mosquito-borne infection for the first round. That's going to be our focus to really respond to the priorities that we're seeing in terms of dengue and malaria in the African continent. And in terms of climate resilient food systems, we're going to really focus on nutritious and healthy food production. And then for chronic disease management, really looking at how extreme heat and air pollution are affecting people with pre-existing conditions and chronic disease. And looking also at supporting climate responsible health service delivery. This will also be applicable to the infectious disease arm, where we're also hoping to support the health system in capacity building, because that also came up in the survey as a big concern, that people felt that they were unprepared to meet the challenges of climate change, surges in infection or chronic disease conditions exacerbated by climate conditions. And so health system preparedness and support is also going to be a cross-cutting feature. I will also add that across all three areas, we are going to support data, so anything surveillance, early warning systems, digital tools, the use of artificial intelligence will be a cross-cutting theme. So the digital aspect will be captured across all three areas, really looking at how do we integrate climate data. And another cross-cutting theme is also gender, looking at how women and girls are disproportionately impacted by climate change. And so we encourage innovation in both those areas. We are very much, while I'm here representing Grand Challenges Canada, I'm also here representing a large network of partners that are coming together to launch this. We know that we need to come together, pool our resources to launch meaningful and large funding programs that will hopefully be able to fund more and more innovations as we align in a way of doing this in a way that's locally informed, guided by local data. And so we will be funding in different stages, as I mentioned, but I will, in the interest of time, I will move forward. But to summarize that, this is a 5+ year program focusing on multiple phases, from early stage ideas for people who just have initial proof of concept ideas, they just want to get off the ground, to people who are ready to scale up their solutions. We're going to focus on low middle income countries, and we're guided by local insights, powered by global partnership, and hoping to get $50 million out the door as quickly as possible. And so we're hoping to launch the call in early 2026, hopefully by spring 2026, and approve the first investments by the end of 2026. And so stay tuned for more information. We will be announcing a call for proposals soon to not launch Nexa in 2026. The RFP design is currently in progress and in a process of being finalized. All low middle income countries will be eligible for funding. And we were really looking for bold climate and health innovation ideas. And so stay tuned for more information on that. Thank you very much.
Thank you so much, Joanna. It's really, really exciting, and really excited to have that very large survey with the results made available for decision makers. So I think that's going to be really super helpful. So now I'm actually just going to take a few minutes to sort of provide an overview of what we heard from participants in the course in terms of the survey results. And I just need to find it here. And I'm going to share this, and hopefully you can see this okay. And so one of the questions was just asking how have participants used tools or methods or frameworks? And similar to some of the presentations we've had today, there was a use of things like the WHO Vulnerability Assessment Guidelines, the operational framework for building climate resilient and low carbon health systems, but other adaptation toolkits as well, like a CARE toolkit and a territorial planning framework. And it's very interesting to look at how these were used in terms of identifying health risks, doing maps of vulnerabilities to inform decision making, planning adaptation measures, of course, securing funding, engaging in community-based adaptation planning, and looking at the institutionalization of climate action within health systems. So a very interesting way some of these were used. And so we also got some really interesting input on some of the difficulties people have reported using the tools. And so we've heard some of these before, data gaps and technical limits, institutional capacity and resources, again, a lack of funding or smaller teams, governance and coordination, perhaps a lack of coordination between local and national levels. Local adaptation and global tools. So a bit of a context mismatch with some of the tools in terms of not enough localized guidance. Even awareness and knowledge gaps, lack of climate and health understanding, perhaps to use some of the tools, and even digital and communications gaps, tools requiring internet or smartphone access, not reaching rural or low connectivity areas, or lack of user-friendly accessible interfaces. So some really interesting and I think important challenges to using some of these tools. And so really importantly, people provided some excellent input on, what's needed here in terms of some of these broad areas. So in terms of operational and practical guidance, step-by-step operational guidelines to translate recommendations into local implementation, train the trainer manuals, practical examples and case studies, more of those in some of the guidance and tools, or simplified data substitution and proxy tools. In terms of data, technology, and decision support, accessible technical packages, guidelines for integrating fragmented or incomplete data so that people can really understand how to do that best. In terms of local context and cultural relevance, templates for community communication adapted to local languages, norms, and mobility patterns, co-governance guidelines defining clear roles between health, environment, and local government sectors, and equity-focused frameworks was also something that's needed. Governance and intersectoral coordination, the need for model agreements, ordinances, and intersectoral action plans, operational guidelines for even resource mobilization, especially in vulnerable territories. So some really interesting examples about what's needed there. On the community engagement capacity building, guidance for effective community participation across linguistic, cultural, and geographic diversity, even local fundraising and crowdfunding tools that can really help with building some of that capacity. And then there were some really interesting ideas around finance and implementation planning and monitoring and evaluation and learning with respect to some of the tools and guidance. So, for example, more information on tracking adaptation effectiveness, or adaptive learning mechanisms to adjust strategies based on the results. So I think there was some really excellent input from course participants on their experiences with using these tools and really what's needed in the future that people can use in the development of further tools. So with that, I will turn to our next speaker. Claudia Saud is a biomedical scientist with a master's degree in bioinformatics from the Federal Technological University of Paraná in Brazil and is a doctoral candidate in the same program. She conducts research in predictive modeling of arboviruses using time series and climate variables and has experience in projects on arboviruses and neglected diseases. She works on developing educational materials and training in health and biotechnology, integrating computational technologies with public health data analysis, and the adaptation of health measures to climate change. So I'm going to stop sharing and invite Claudia to make her presentation. And thank you so much, Claudia, for bringing your knowledge and your expertise to everybody today.
Obrigada, Peter.
Thank you so much, Peter. Good afternoon to you all. I'd like to thank for the opportunity to be here showing you or sharing with you a little bit of my master's project, which is its applicability. So just a second, please, so I can share my presentation with you. Just a second. Is this screen appearing to you? Can you see my screen?
It's not in full screen mode yet.
Só momento.
Just a second, please.
Sure.
Foi agora, né?
There we go.
Obrigada, Peter.
Okay, thank you, Peter.
Bom, o meu projeto, vou falar
Actually,
rapidinho por
my
causa do
project, I will
tempo,
speak very, very
mas
quickly
ele é uma
because of my
modelagem
time limitations, but it
para
is
dengue, para os casos de dengue.
a predictive
Esse
modeling
projeto ele foi
for dengue
aplicado
cases.
aqui em
This
Londrina,
project was
na
applied
cidade do
here
norte
in
de
Londrina,
Paraná,
which
no
is a city in the
Brasil.
north of Paraná,
E
which
ele
is a
tem o
state
intuito,
in South
principalmente,
Brazil, and its
de
main
trazer a
purpose is that
aplicação,
of
né, a
bringing
ciência aplicada. Então,
actually
não deixar
bringing
só
applied
na
science, not
universidade, mas
only
a
have knowledge
pesquisa
being back
fazer o
there in the
bem
university,
maior,
but actually
fazer algo
having
para
research to
todos,
do
dessa
something
maneira.
good for all in
Então,
this
eu
way.
terminei o mestrado
So I
e o
completed my
projeto
master's
conseguiu
degree,
esse
and
ano
so
ser
my
aplicado
project
dentro da
was
Secretaria de
applied
Saúde
today within the
aqui
State
do município de
Secretariat,
Londrina, no
the
intuito de
Municipal Secretariat
trabalhar
of Health
dentro da
in
vigilância
Londrina, aiming at working
Então,
on
o surto ele existe,
epidemiological
sim,
surveillance. Is there an
mas
outbreak?
como pode ser
Yes, there is.
feito algo
But
para que, quando
how
esse
could
surto
something be
chegar,
done so that
você
when this
tenha
outbreak
recursos para
emerges,
trabalhar?
we have the
Então,
necessary
o que eu
resources to
posso
work on it?
fazer, né, de
So what
modo
I
a
can
já
do, what can I
prevenir,
do
prever algo
in
futuro que
terms
vai
of
acontecer,
predicting something that
principalmente
will
quando a
be
gente está
happening in the
falando de uma
future,
doença que está
especially when we
relacionada à
talk about a
sazonalidade.
disease which is linked to
Então, além de
seasonality?
ser aplicada
So in
esse
addition
modelo para
to
dengue, nós
having this
podemos já
model being
aplicá-lo também
applied
para
towards
outros
dengue, we can
tipos de
also apply it
arboviroses.
towards other kinds of arboviruses.
Toda a minha pesquisa,
All
o
my
código,
research
né, que
study,
eu
all
escrevi por
all the
detrás da
code I wrote,
interface,
in other words,
ele
behind
foi
the
disponibilizado no
interface
software
itself, the UI,
R,
it
então o
was
software é
used in a
totalmente gratuito,
R software, which is fully
qualquer
free,
pode, né, utilizá-lo.
open
E
software.
a
Anybody can
parte
use
final,
R
que é a
language.
interface
And the
do
final part of
usuário,
it, which
ela
is the
também foi
UI,
feita no
the user
Shine,
interface,
que é
was also
totalmente
done
gratuito.
using the
E
Shine, which is a
eu criei uma
fully
interface
free
que ela fosse muito
software. I
fácil para o
created
usuário,
an interface that could
para que
be
ele
easily
conseguisse
used, it could
utilizar
be
qualquer profissional
user-friendly,
da
so that the
saúde,
users
mesmo sem
or
ter
any
conhecimento da
healthcare professional
bioinformática
could
por
use
trás.
that, even
Então,
without
de
knowing the
modo que
knowledge
eu, como
about
professor, ou eu
bioinformatics,
como
etc. So that
epidemiologista
I
da área, eu
myself, as a
consiga
manager, as
inputar
somebody
o meu
from
banco de dados
technology in the field, so that I can have
profissional
my
e consiga
database
rodar e
fed
trazer,
by
então,
people so that it
tudo
can
que eu
run and
preciso,
bring
todos
to
os
me everything
dados
I need,
necessários para
all
esse
the
modelo
necessary
de
details
predição.
or data for this prediction
Aqui
model.
só um panorama
Just
geral da minha pesquisa.
this is
Então,
a
eu
general
consegui
overview of my
usando os dados,
research.
né,
So
para
I
fazer essa modelagem
collected the data to
estatística de
do this
predição. Eu
modeling in terms of
precisei
prediction
fazer, então,
statistics.
criar o meu banco de
For
dados,
that,
porque
I
não
needed to
existe um banco
establish
de
my
dados
database
completo.
because there is no
Então, eu
full
peguei
data
informações
set or
do
database.
dengue
So I collected
e
information from
peguei informações do
InfoDengue
INMET, que
and
é o
I
Instituto
collected information from
Meteorológico,
InMetro, which is
auxiliando
our
esse banco de dados.
meteorological
Então,
institute, to
números de
establish this
casos
database
baseados na semana
based on the number of
epidemiológica,
cases within that
assim como
epidemiological week,
covariáveis,
as well
para
as
rodar o modelo
using
SARIMAX, que é o
covariables
modelo de
to
predição.
run the
Então, eu peguei
SARIMAX, which is the
temperatura
prediction
e
model. So I
umidade
collected
mínima, média e
temperature,
máxima, assim como a
humidity, minimum,
precipitação.
average, and
Todas
maximum, as well as
essas variações
precipitation. So
climáticas,
all those
elas
climate
estão
variations,
interferindo
they
demais
are
no
directly
número de casos.
interfering
Então,
in the
esse
number
número
of
de casos ele
cases.
está
The number of
crescente a
cases of
cada
dengue
ano.
actually, it
E
actually is
isso se
growing
deve
every
a
year.
essas
And
alterações.
all that is due to
Então,
those
depois de
changes.
fazer todo
So after doing all this, the large compilation, I did the pre-processing of these data. I analyzed the description of those data that I'm not going into details here because of the time limitations, but finally I did the statistical modeling, both using SARIMA on the top there, which will analyze case by case, as well as SARIMAX, where I can use cases versus exogenous covariables. Is this a minimum humidity? Is this maximum humidity? Is this temperature? So I can actually track that, and it generates the graphs so that based on those, I can actually make my comments. It's important to identify what is the covariable that will cause an increase in the number of cases during that period of time. So is there too much humidity? The number of cases has increased. Is this temperature, etc. So after some time, I did it so that all these things became visual. The two models, they presented very good results, and I will be showing you in the coming slide. However, I thought, well, what sense does it make having a lot of codes if people do not understand what they mean? It's best to create a user interface, and I will be showing you this here, so that the user may, from that database over there, do their own job and having all that sampling, that panorama of overviews shown to the user. These are the results with the modeling process. And here on the first one, I have the SARIMA model. In all graphs, the black line represents the number of actual cases of the disease, confirmed cases of dengue. And in red, or both continue, the dotted line and the dashed line, we have the modeling itself.
Que o pontilhado, a linha vermelha, ela segue certinho. Então,
the best model was SARIMAR because the dotted line and the dashed line follows the same line as the previous one.
E aqui o produto então dessa aplicação web. Então aqui eu tenho o quê?
And this is a product. Now we have the first page, which is data inclusion. So I just add data and browse, and I get all this scenario. Year, week, cases, humidity, all variables are there, each of them in a different column. And then I have a description of all information generated by this data set. And then I can carry out analysis, which is what I did. So the correlation, partial correlation of data, everything in graphs. And I can also do, as I mentioned before, is to conduct a cross relation. On the left, you can see what I have, which is a variable. I have the number of cases, and I compare that with the other variable of my interest, so I can cross-check with medium, maximum, humidity, temperature, so on and so forth. At the end, I can stabilize a model. I define parameters, and all parameters are adjustable, and I can run the SARIMAX, which is the model of a prediction model that I used, so that I can have an estimate of the cases. So both models, as a matter of fact, operate as a forecast, a weather forecast. So the previous data provide a future perspective of what might happen. So I have both data here on the table and also shown as a graph. So the graph appears here, and on the bottom of the screen you can see data on a table. So and the information is on a weekly basis. For example, week 1, 2016. So how many cases of dengue could eventually happen? Of course, this is a prediction. We're talking about a forecast, an estimate, a model that is based on history. It could be higher, it could be more cases, less cases, but the difference would be minimal. We don't notice the difference based on the studies that we conducted so far. So here I have our QR code for our interface, so you can, if you want, can just access that either through the QR code or the link that you see here on the bottom. So I can also change specific aspects or whatever specifics that you need. That depends on our criteria. And this is the GitHub of our research in case you want to get more information and more details. And I have my email address and my telephone number. Please contact me. Thank you very much for the opportunity. And I was very brief and quick. I didn't want to take much of your time. So thank you. And of course, I don't want to disturb the end of the conference, but this is just a gist of what we did, and our intention is to help. Of course, one person might not change the entire history, but altogether we'll be able to save our planet. Thank you very much.
Wonderful. Thank you so much, Claudia. I really like the emphasis on, the developing interfaces that users can apply, and making sure that that these tools are applicable by a wide range of health authorities. It's so important in terms of that. So I really enjoyed your presentation. So I'm going to have an impossible task now for all the speakers. So I ask you to come on camera. In terms of some of the challenges that we've seen either in the presentations or in the survey results for using tools and guidance, and maybe even scaling up, I'll ask you fairly quickly just to identify what you think might be a top challenge. And perhaps if in your work or your experience, you've got a solution for everyone, but certainly identifying, a top challenge. So maybe I'll start with Avril. We'll go from the top in terms of the presenters, and then go down. Avril, can you share something with us? Thanks.
Could you repeat one more time? Sorry, my internet is not great.
No, that's okay. Just a key challenge in terms of, we've heard about a lot of common challenges, I think, that a lot of people have in terms of these tools. Is there something that comes particularly to mind to you through your experience, that maybe something we really need to address first in terms of scaling up?
I would say that one of the biggest challenges is political will and political mandate. And if we can get the highest level to be on board, so that way there's more priority given towards health systems to be working at the climate and health interface, that's a key area I think we all need to be pushing for. And I can tell you from experience that the countries that have that political mandate and have that political will, it is so different than working in countries that don't have that. Because at the end of the day, you actually can have time allocated towards working on these crucial, issues that we're all trying to make a little bit of a difference in.
Great, thank you so much for that. And I'll see if Rachel might have some thoughts for the group. Maybe okay. We'll come back to Rachel if we have time, perhaps.
I'll be with you in
Rachel.
1 moment. I'm sorry, it's just at this time of night. I'm just sorting out my son. I'll be with you in 1 moment.
Oh, that's no problem. Thanks, Rachel. Maybe Anna, have you got a challenge for us?
Sí, me parece muy
Yes,
importante.
I think it's very important. What Avril said is important: political will and engaging governments to make these changes. But also, I think it's important to bring the academia closer to the territory. That's essential, because many of the studies conducted are just left behind as studies, and they're never really implemented to what is happening in the territory. So bringing in the territory and the academia together so that we can actually include all these changes in the territory. And sorry, when I say territory, it's not just the community level. I mean the territory where the health staff works, community health centers, first care centers, because that's also territory, and they will be multiplying these efforts. Thank you.
Very interesting. Thank you. Thank you for that. Maybe I'll turn to Johanna now.
Both great points, and I would adding my support behind those two comments as well. And just to add that I'd also love to see more, and we saw some examples of this, but more regional cross-global collaboration. There's a lot of amazing work and innovation and ideas and tools being developed in different parts of the world. And it hurts to see some duplication, you know, and as a funder, we get to see everything coming in. And I just think, oh, if only these people connected with these people. And we're trying to see how we can do that. But I'd love to see countries and researchers and innovators working together to share these ideas around the world and seeing more networks that facilitate this sharing of information and sort of rising to the climate challenge together, again, regionally, cross-regionally, globally. And so I'd love to see that more as we scale up these ideas.
Thanks so much, Joanne. And I think as there's more activity, that's going to become even more important. Yeah. Maybe Claudia, have you got any thoughts on a particular challenge, perhaps in your project that you faced?
Well, as a matter of fact, a major challenge in our case was to get data. As a matter of fact, to obtain data. The data that I got are there, like open source, they're available. About type, that it would be a covariable that could be implemented, added, but I don't have that information. And for me to get that information, it's so difficult. Just now that the health department is kind of giving me the go ahead, a green card, and it's kind of they bought my idea, and so I can use, but it is a fight. And it is we're struggling, you try, and you cannot get it all the way you want. You want the data, you want to do something, but it is so hard to get and carve the information and implement everything that you are proposing from our point, at least from their point of view. So this is the major difficulty that I had.
Great, thank you. And I see Rachel. Rachel, have you got a thought on particularly with the work that you're doing and your collaborations, you know, a key challenge that comes to mind?
Yeah, I really agree with Claudia. Accessing the data you need to build these models and then also being able to update that data in real time, because sometimes you can access data to formulate a model, but then when it comes to implementation, unless you have that real time incoming stream of data, both like disease surveillance, climate forecasts, and the whole pipeline to process that, then the implementation is impossible. So I think this kind of live stream flow of data is very important. Of course, as Joanna pointed out, that the funding is a real challenge. We've been having to string together different pots, and it's very difficult to have continuity and stability of the workforce and the teams with very patchy funding. So that's always really challenging, just having to scrap around for soft funding all the time. And yeah, I mean, we've been very lucky in our partnerships that we've had real buy-in from the sort of high-level partners, which gives the mandate for other actors to take part. So that's been great, but that doesn't happen everywhere. So I think unless you have that buy-in from the high-level policymakers, then it's very difficult to be able to actually have something that can be implemented and scaled up.
Wonderful. Well, I'm told we have just a few more minutes, and so maybe I'll ask if people are aware of new guidance that either you're developing or that others are developing that people should know about, or maybe that you think needs to be developed in terms of some of these challenges. So I'll just open it up if people are aware of these kinds of things. I know that the WHO is developing some quality criteria guidance, I believe, for conducting climate change and health assessments, which I think is really exciting. But do others have thoughts on guidance that's either needed or that they know is being developed that people could know about? Not so much in terms of, well, I mean, this is probably a future need then in terms of some of the challenges that folks have identified. But I think we're pretty close to the end of time anyway. So and we can actually include it, I'm told, in the chat because that would be really wonderful input if others participants are aware of guidance that they think is needed as well. So I think we have reached the end of the webinar today. And so I just want to thank our really excellent speakers. for your time, for your thoughts, but also thank all of the participants that came to the session. Really hope that you can join next week. I believe next week's the last week of the course, and there'll be a session on partnerships for scaling up, but also a course on how do health decision makers and health authorities move forward with building resilience of their health systems at the same time that they're moving towards low carbon health systems. You need to do both. And so I think that's going to be a really interesting session as well in terms of how do we scale both of those activities up. So I hope everybody has a great rest of the day. Thank you again for your time. And I hope this is really of interest and enjoyable to all. Have a great day. Thank you.